that's her, but not me, right? I mean, in our 30s, we're thinking, I'm too young, menopause has nothing to do with me. Well, now we know it's time to listen up and it's time to wake up because it is very likely that a lot of the symptoms that we experience in our late 30s and early 40s could be due to perimenopause.
Welcome to Suburban Warrior, the podcast that will impact, inspire, and empower you to transform your mindset and become the badass warrior that you are. I'm your host and fellow warrior, Chrissy Pfeiffer, former clinician and corporate marketing exec turned multi-passionate entrepreneur, performance and life coach, and mom to 4 not-so-little warriors. Each week, I will bring you honest conversations with inspiring guests to share their stories of resilience, optimism, success, and simple yet effective strategies so that you transform your thoughts and change your behavior to get the results you want in your life. You will be empowered to take action, warrior up, and believe in you. Let's do this.
What's up, warriors? Welcome back to another episode of the Suburban Warrior Podcast. I'm your host, Chrissy Pfeiffer, and this episode this week is going to be a special solo episode with yours truly. You know, I have all of these amazing guests on each week, and we're focusing on everything health and wellness for women in midlife during this entire season because I think that it is such an area that we need to be focusing on, talking about. And there's just so much information out there, so much for us to know that this is it. This is your platform to find out about everything health and wellness related. So, because I have all these guests on that are talking about all the different ways that we can help alleviate menopause symptoms, and we discuss what menopause symptoms are. But some of you still may be wondering, like, what is menopause, right? And not only what is it, but why do I need to know about it? Why do I need to care about it? Is it something that I am in? Am I experiencing menopause? Like all of these different things that I think are going through people's minds. But also, like, what does the term perimenopause even mean? There's so many phrases, postmenopause, that I think people are kind of confused as to what is what. So today I thought I would just break down some of the basics. We could talk about what is menopause, perimenopause, postmenopause, what do these terms mean? And really, why is it so important for us to be discussing it? Because it is something that more and more people are talking about. It's sort of everywhere. I don't know about your feed, but it's everywhere in my social feed. And I think that the more we talk about it, the more information and education that's out there, the better it's going to be. So, as women, we spend about 30% of our life really in postmenopause. And this is a phase of life for women that has not really been very well understood. What happens to us, what happens to our bodies. It's been understudied in science. Doctors, nurses, nurse practitioners, have literally been taught pretty much nothing about menopause. Even OBGYNs who specialize in women's health, they get maybe a few hours of their entire medical school education dedicated to menopause, which is really crazy when you think about it, that women's doctors who specialize in women's health care, they get tons of training on pregnancy and women's bodies and how to deliver a baby and surgery and all these wonderful things, which is obviously much needed. But none of their training, except for maybe an hour or two, has focused on the entire latter 30% of women's lives. And about the same amount of education is focused on nutrition for these physicians. And I just dropped that little hint because that is also crazy in itself. And that is probably going to be another topic of an entire other podcast in itself. But, we'll touch a little bit on both of those topics today. But I digress on the nutrition. So what is menopause? Well, menopause is actually one day. It is the day, just one day in your life, that is 1 year from the date of your last period. So, after a full 365 days of not getting a period, that is your menopause day. After that day, you are technically in postmenopause. And the years that lead up to that day, you're in perimenopause. So it's perimenopause for an undisclosed, who knows how long amount of time from when symptoms start to your day of menopause, which is 1 year after your last period. Then, technically, the rest of your life, you are in postmenopause. I know these terms are used very interchangeably. A lot of people just say, I'm in menopause, I'm menopausal. Fine, that's okay. But just so you know, that that's actually what the terms technically mean. So, what does it really mean when you're in menopause? Well, what it really means is that you have run out of eggs. The millions of eggs that we're all born with in our ovaries decrease down to about 3% of that volume of eggs by age 40. So our ovaries start producing a whole lot less reproductive hormone at this time. And those reproductive hormones are estradiol, as we know is estrogen, progesterone, and testosterone. And this decline in all these hormones is, when things really start to get sticky. And this is where we really need to educate ourselves and each other about perimenopause because symptoms can start to appear for women in your mid to late 30s. And trust me, I've been there. That was me with symptom after symptom in my late 30s and early 40s with no clue that it was due to an estrogen decline because most women in their late 30s are really not thinking about menopause, like not at all, like not even on your radar yet, right? I mean, menopause is something that my mom went through. It's our moms go through. We don't really think of it that much for ourselves, especially not when we're in our 30s. And when our moms went through it, maybe she had a few hot flashes, complained she couldn't sleep. Maybe her mood swings turned into rage every now and then. And we like backed off and we're like, okay, yeah, no, that's, crazy. And that's her, but not me, right? I mean, in our 30s, we're thinking, I'm too young, menopause has nothing to do with me. Well, now we know it's time to listen up and it's time to wake up because it is very likely that a lot of the symptoms that we experience in our late 30s and early 40s could be due to perimenopause. And we need to be cognizant of that and we need to educate ourselves because our medical system is not built or designed to tell you when you're in perimenopause. There is no real test to say black and white, you're in perimenopause. The doctors are not going to test your hormones. If you walk into an appointment with joint pain, they're not going to say, oh, it must be because you're perimenopausal and have a declining estrogen level. That's just not what's going to happen. And unfortunately, it's just because most doctors still don't understand all of the things that are going on in a woman's body. So they certainly aren't going to tell you you're in decline of hormones such as estrogen and progesterone and testosterone, and that they're the cause of all of your symptoms like recurrent UTIs or frozen shoulder that you just suddenly woke up with one day. Really, if you are starting to experience any of these symptoms, waking up in the middle of the night, lying awake in the middle of the night, like a deer in headlights, like I was, with your mind racing and thoughts that are you just can't fall back asleep. Physicians are going to hear what your symptoms are. They're going to want to treat your symptom with maybe like a sleeping pill or something like that, but they won't think to go to the root cause of what that issue is, which for the most part could be declining hormones. So, estrogen is a protective hormone and it affects so many different systems in our bodies. We need it for heart health, for bone health, sexual health, just to name a few. And why is it important? Well, first of all, think about this. Heart disease is the number one killer of women, and declining estrogen levels especially during menopause, can negatively affect your heart health by increasing the risk of cardiovascular disease. And that could be due to factors like inflammation, our blood vessels get stiffer, our blood vessels are less elastic due to the declining estrogen. And we have all these negative changes that also happen in our cholesterol levels, like higher cholesterol, higher triglycerides. So, all of this can lead to a higher risk of cardiovascular disease, higher risk of heart attacks, and stroke in women. I mean, this is huge. This is such important data that has been coming out in the last several years. Some of it we've known for a long time, but knowing that estrogen and the decline of estrogen could be tied to our cardiovascular health, and we could be losing estrogen levels in our 30s. Okay, this is a huge topic of conversation that should be shouted from the rooftops and that every woman should know about, right? Like many women have completely normal cholesterol levels their whole life. And then all of a sudden they might get their yearly blood work done and their cholesterol is through the roof. And what happens then? The doctor says, well, you have high cholesterol, so now you need to be on a statin. Okay, well, once you're on a statin for high cholesterol, most likely you're going to remain on that statin for the rest of your life. So now you're on a prescription drug that you believe that you need because that's the story that you've been told by your medical professionals because your cholesterol is high. But really, your cholesterol could be through the roof due to declining estrogen levels. So, do you need to be on a statin? Maybe. I'm certainly not dispensing hardcore medical advice here. I'm just saying that it is very possible that maybe just replacing some of that estrogen, maybe through whether it's naturally through diet, through supplements, or through HRT, which is hormone replacement therapy, you may not ever need that statin at all. And, statins are pretty heavy duty pharmaceuticals. They come with a lot of side effects. One of them being very, very severe musculoskeletal pain, which we don't need more of because we already get that through our declining estrogen levels. So, and we can talk about that in a bit. But again, it's about going to the root cause of why your cholesterol is spiked or whatever symptom it is that you're experiencing. Another big one with menopause, bone health, right? Decreasing estrogen levels significantly decrease bone density because it accelerates the bone breakdown and it also inhibits new bone growth from forming. So, all of this leads us women to a higher risk of osteoporosis and fractures because the bones are just weaker, right? And we hear about osteoporosis, we know about it, but most women are not being checked or screened for osteoporosis until they have an osteoporotic fracture, which that's too late. We don't want to get there. Estrogen acts as a protective factor for bone health. So when we lose it, we lose the protection for our bones. I recently had a DEXA scan because I requested one from my doctor, and DEXA scan, which is a test that measures your bone density. Very simple test. It's sort of like an X-ray, quick, easy, painless. Like everybody should be getting one. But I had really no real reason to think that I had any issue with my bones. I am not having any pain. I'm not having any joint pain right now. I exercise, I lift weights. I feel like my muscle strength is pretty good. So I have no real reason to think that I had any bone issues, except for the fact that I know better now. And I know that I went through 5 years of my life in my 40s with, or maybe, and that was just the years that I knew about, probably even more, 8 to 10 years with declining estrogen and almost zero estrogen in my body. So I did have some concerns and I requested the DEXA scan. And as expected, I have osteopenia. And osteopenia is the precursor to osteoporosis. So, my body being depleted of estrogen for 5+ years as a young 40-year-old, that is no surprise that I have osteopenia. So now what am I doing? Well, I'm at a much higher risk for osteoporosis. So I'm trying to do everything that I can to reverse it, which you really can't reverse osteopenia, but I can slow it down. And I can do that by, lifting heavier weights, by making sure I'm eating enough protein, by trying to increase my muscle mass, by eating foods that are high in calcium, all of these things. It's doing exercise that requires jumping because that helps our joints and our bones strengthen. So all of these things that I'm really cognizant of. Now that I'm on HRT, I'm hoping that it really helps to slow the osteopenia, and maybe I can reverse it or stop it from really progressing into osteoporosis. So, let me tell you a little bit about my menopause journey and why I am so passionate about no woman ever having to experience or go through what I went through. Because, I look back now, hindsight's 2020, right? I look back now and all the years leading up to my menopause with such clarity, but at the time, it was tumultuous. It was years of one health issue after the next. Being a working mom with four kids, ranging in age from, at the time, this is preschool to high school age. And I was literally constantly chasing feeling good. I mean, it was always something. The list is long, but these are some highlights of what I was experiencing. And this is in my late 30s, early 40s, prior to anyone ever saying the word menopause to me. So I definitely had some major GI issues. I had bloating, gas, constipation, GERD, which is reflux disease, and I was eventually diagnosed with SIBO. And so all of these things that were gut related, I have no doubt were due to my declining estrogen levels, because prior to that, I had a pretty healthy gut and I felt pretty good. And then all of a sudden, I started to have all of these gut issues. So, time after time, seeing the gastroenterologist, being put on medications, having all these tests done, without really resolving a lot of the issues. Do I have a gluten allergy? All of these things, who knows? I had joint pain. All of a sudden, I started to experience joint pain, like waking up in the morning, my knees, my elbows, my shoulders, everything feeling stiff and painful, hurting to just even walk, getting out of bed in the morning. That was new. Did I have an autoimmune condition that was causing this? Was I experiencing arthritis? Again, no answers to any of this. I had allergy and asthma flare ups. I had been a severe asthmatic my entire life. I mean, from the time I was a toddler throughout my entire life, I had severe asthma. In my late 30s to early 40s, man, did my asthma get worse. And also, which was allergies. And my allergy flares got worse. I felt like, I would drink something or eat something, and all of a sudden I'd get like red patches all over my skin, which had never happened before. I had recurrent respiratory infections, like resulting on being on multiple meds, having to be on antibiotic after antibiotic. And again, like no wonder my gut was inflamed from all of these antibiotics. But, never did I think that a recurrent respiratory infection or flare up in my asthma could have been related to declining estrogen levels. I had migraine headaches, which were now, I look back, most likely menstrual migraines. This is a big one. I had heavy, painful periods, like never experienced in my life heavy, painful periods, resulting in like not being able to leave the house, like hemorrhaging during my period, sort of thing. And again, that was new. That was something that I had never experienced in my life. Now, did I hear that sometimes later in life your periods could become a little bit irregular, they could become a little different? Sure. But again, had no clue that it was due to declining estrogen levels in my body. I also had recurrent yeast infections and UTIs, like not fun at all. I mean, I just really, really wish I had known that all of these things could have been helped had I added just a little bit of estrogen back to my body. So these were just a few highlights, to name a few, and prior to me actually learning that I was in perimenopause. But what really solidified it for me was it was like one day someone came in and they literally flipped the light switch on in my body. And I started developing what I didn't realize at the time were hot flashes. because up until that point, I'd never experienced a hot flash in my life. You can think like night sweats, are hot flash. They're not. A hot flash is is just like nothing you've ever experienced before. So I went to the doctors and my OB-GYN exclaimed as she walked into the office, "Welcome to menopause," as she was holding my blood test results in her hand like they were some coveted prize that I just won on a game show. And I was sitting there, I remember like night and day, I mean, like it was yesterday, sitting on the examination table, wearing that, glamorous paper gown, feeling absolutely terrible because 3 weeks earlier, I began feeling something in my body, which I had never, ever experienced before. And again, I'd heard of hot flashes. I'm a nurse. I had a mom who experienced hot flashes. I had gone through pregnancies. But what I was experiencing now was clearly like not what I thought a hot flash was. This had to be like a symptom of some other illness or some crazy disease that was setting in because about 30 times a day and 10 times a night, it felt like the devil was trying to extricate himself from my body. I mean, it would start feeling like in my stomach and it would feel like my stomach was dropping. You know, that feeling when you're like on a roller coaster or you're going over a bump in the road too fast and it feels exhilarating and fun. Yeah, but not when it's followed by slowly what feels like flames igniting from the center of your body outwards. And as it begins to build, you feel your skin getting red and your pores start to ooze liquid like you've just stepped out of a sauna. Your mind goes completely blank. And like, because how are you supposed to think of anything? All you can focus on is the fact that flames are engulfing your organs and you're just wondering if this will start to come out and everyone around you will see that you're actually on fire. Like that's what it feels like. So forget about trying to function, right? Forget about if you're in the middle of a presentation at work or in a deep conversation with friends or anything like that. Like your mind just goes completely blank during these hot flashes. And a hot flash sounds so mild, like no big deal. It's a hot flash. Well, not so much. So if when it felt like a switch literally flipped in my body one day, I went from never experiencing a hot flash in my life, which again, I didn't know that that's what I was experiencing at the time because after 3 weeks, I'd gone to my doctor. Because I literally thought I'd contracted some crazy disease and maybe needed antibiotics. So my doctor ordered some blood work, went to my OB-GYN, and it could be menopause. I said, menopause? What? I'm like, no, no, no. You don't understand. That's crazy. I'm 43 years old. Menopause. Menopause is like for 55-year-olds. I mean, I'm not in freaking menopause. What the hell even is menopause? It's not even something I had thought about. But for me, that is what started it all. I was losing estrogen and progesterone, and my body was trying to tell me in every way possible that it was not ready for this estrogen loss. But who knew? Certainly not me. And neither did the doctors. And that's an issue with our modernized medical system. But we'll talk about that probably in another whole podcast because I could go on and on about that forever. And that is something really important. But it's important for us to understand as women that this is something that we cannot fully lean on our medical system for. So, what did I do? I continued I continued to see all these physicians. I continued to get tests and blood work done. I was put on drug after drug for all of these different symptoms, rounds of antibiotics for UTIs, recurrent yeast infections, you name it, respiratory infections. And, the doctors were trying to figure out, did I have a severe autoimmune disorder? Maybe. Did I have a gluten allergy? Possible. I mean, these are the type of answers that I was getting from all of my doctor's visits and tests, but nothing conclusive. And nothing really pointing out as to why this was happening and why my body was breaking down slowly, except menopause, but no one had any answers. And I specifically remember driving in my car to yet another doctor's appointment and thinking to myself, this is my life at 40, 42, 43. I think I was 40 at the time when this revelation happened, but all of these prescription drugs And I'm spending so much of my time going to see specialist after specialist for all these tests. And if this is what life looks like for me, a generally healthy, highly functioning woman at 40 years old, then what is my life going to look like at 60 and at 80? And that thought hit me and hit me hard because I didn't just want to live my life going from one doctor's office to the next with symptom after symptom, feeling like shit and getting very little relief with all of their solutions. So, just like you and every other human being, all I wanted was to feel good. All I wanted to do was to wake up in the morning feeling energized and ready to attack the day. And without our health, every single aspect of our life is affected. I mean, how can we share all of our gifts with the world when we can't even remember why we freaking walked into a room? And that is a serious problem that a lot of women are facing. So maybe if you're listening to this podcast thinking, listen, I don't have any symptoms at all and I feel great, which I hope that is the case and good for you. That is amazing. And I hope it lasts for you forever because it might. You may not experience one menopausal symptom your whole life. But if you're in the 85% of women who experience menopausal symptoms, which 85%, that's a lot of women, then you may be experiencing one or more of the 34 most common menopausal symptoms that exist. So let's talk about some of these symptoms, or let's talk about them, whether I rattle them off or get in a little bit more detail. Let's talk about what they are, because the key, ladies, is that if you start feeling any of these symptoms, you need to understand that it could be perimenopause. Is it possible that's not? Of course. Of course. And you should go to a medical professional to figure that out. But you might need to know. I mean, you might need to advocate for yourselves and say, could this be perimenopause? Could this be my estrogen declining? And if so, you need to be at a physician's office who is going to investigate that, talk to you about it, possibly test your hormones, although there truly isn't a great hormone blood test because your hormones are fluctuating all throughout perimenopause. So you could be tested one day and it could show that you're absolutely fine, and you could be tested the following week showing that you're not. So that's why it takes a really skilled physician in the area of menopause and perimenopause to understand and diagnose and treat your perimenopause. So hot flashes, we talked about that. Common cause. Not every woman is going to experience them. Night sweats, another one. Irregular periods. And irregular periods could mean anything from missed periods, a heavy flow of periods, painful periods. It's really a change from your norm. Like, what is something that you're noticing that is changing significantly? That could be the start of perimenopause. Okay, we all know about the weight changes, right? So, declining estrogen and loss of muscle mass can affect the way that your weight is distributed in our bodies. And this is what leads to what we all know as sort of that little belly pouch, that meno belly that we call it. It's not a pretty name and it's not fun at all because once you start experiencing meno belly, you're like, where did this come from and why can't I get rid of it? And you can literally try to starve yourself and you will still be retaining visceral fat. It's a different type of fat in your belly if it's left unchecked. Also, weight changes can happen because of the other symptoms that we experience during perimenopause, which are mood changes and fatigue, right? And these things can all affect our diet and how our eating habits might change. So weight changes can happen. We can have breast tenderness, mood changes. Like people really talk about the menopause rage. It's real. It's real. And you have to understand that it's real because it's changes in the hormones in your body, which mean your brain, your gut, your organs. It's not just because you're pissed off. Like, yeah, you might be pissed off, but you might be enraged because of the hormone changes. And, I think this is really important because you need to understand like the negative self-talk, beating yourself up, feeling mentally like shit all the time isn't your fault. It is a chemical imbalance that's happening in your body that can be fixed. So, mood change, irritability, depression. Like, this is really important to understand that if you are starting to feel, some type of depressed mood and depression, this is also another symptom of declining estrogen in your body. And many, many women experience this and they're put on SSRIs, which again, that may be what's right for you. I'm not trying to say that, diagnose everyone in a podcast, but SSRIs come with a lot of other side effects when you could try to either naturally and holistically increase your estrogen levels through supplements, or there is, the estrogen HRT supplements that are life changing for women. And these are the things that you need to know about. Anxiety. I know that so many women that I talk to, as clients, like have never experienced anxiety in their life. And then all of a sudden, anxiety and panic disorder, both of these are symptoms. They start having these sort of out of the blue raises in anxiety. And that could exhibit some by heart palpitations, sweating, thoughts of, severe damage, fear of things happening to you or people that you love. I definitely had this. I had all of these crazy thoughts that started to come in my head out of nowhere. And I recognized that it was so weird that it just started to happen to me. And because I'm a coach and I have strategies myself that I could turn these things off, it really helped me. Had I not, I think I would have really gone into some type of, anxiety disorder or panic disorder because you have to switch those thoughts as soon as they start coming in your head. You cannot let them take over. And again, due to the chemical imbalance, these are things that are happening. So if you're noticing these things, again, estrogen, sleep issues, huge. So many different types of sleep issues, right? We can have interrupted sleep, poor quality sleep, meaning we're not really getting the amount of like deep sleep that we need to be restorative. We can have trouble falling asleep, trouble staying asleep. All of these things, sleep, and as we all know, ladies, sleep is so vital to us for restorative, to keeping everything running properly. If you start not sleeping well, night after night after night, things start to break down. So sleep is super important. Also, if you're not sleeping well, guess what you get? Well, you get fatigue. So declining estrogen can also lead to fatigue. It can, not just the declining estrogen, but the declining testosterone at this time can lead to decreased libido. And if you have a healthy sex life and, you all of a sudden are noticing that maybe not so great anymore. You have a decreased libido. Maybe it's also due to vaginal dryness and so therefore causing pain during intercourse and making it not so fun anymore. Your orgasm isn't as strong anymore. So, you're like, why bother? All of these things, guess what? Decreased estrogen, headaches, uh, thinning hair, which that was another big one for me. I lost so much hair. I mean, like it was a crisis. I was almost bald. It was awful. I went through a whole hair journey for myself. But if your hair is thinning, don't sleep on it, ladies. You need to address it because it's only going to get worse. Because as your hormones start to decline, your hair will start to thin. So, and the hair is something that not does not come back quickly. It takes a year minimum to get your hair back to normal. So, if you're starting to notice a decline in this, there are so many things that you can do. You can do red light therapy. There's minoxidil. There's oral supplementation. There's great shampoos and topicals out there. So many amazing treatments for hair loss and thinning. Again, I urge everyone, don't wait till it's too late for that because I did. And it was really traumatic and not fun for me at all. Brittle nails, bloating. Bloating goes along with a lot of the GI issues that I sort of touched on earlier, all the digestive issues that come along with, so no longer having estrogen to help with your gut. So that could be, reflux. It could be how you absorb nutrients. It's gut, small intestine, everything. Brain fog. That is real. It's not just like we're starting to like dumb ourselves down. Brain fog is a real thing and it's a real problem for us women. Memory problems. Like I joked around earlier about like forgetting while you walk into a room. I mean, that is real. How many of us stand in front of the refrigerator, forget why we opened it, or walk in a room and forget why we walked in, or you're literally mid conversation and your mind just goes completely blank and you're like, what was I even talking about? What was my point? Where was I going with this? I mean, it happens all the time, and it is a symptom of decreased estrogen in your body. Joint pain, another huge one. And debilitating. It is debilitating for women. We need to be moving, we need to be active, we need to be moving our bodies. There is no time for joint pain in our lives, especially when it's not related to another disease. It's just related to estrogen decline. Muscle aches. I mean, so many women end up being diagnosed with autoimmune diseases, which again, autoimmune, like everything autoimmune is really due to chronic inflammation in our bodies. And chronic inflammation occurs when our body's natural immune response, which normally in an acute inflammation, like when we break our bones, we cut ourselves, you trip and fall, anything that happens and your body needs to heal itself in an acute state, the inflammation is great. That's what we need. But when it becomes chronic inflammation and our body is staying in a state of inflammation because it feels like it constantly needs to heal itself, that's when we get autoimmunity. And estrogen is a protective anti-inflammatory hormone. We need it in our bodies. And that's why so many women in menopause end up experiencing or getting flare-ups in autoimmune diseases. Other things and muscle aches, a lot of women end up getting diagnosed with fibromyalgia and putting on, again, heavy duty medications that they don't really need when they could just be supplementing for estrogen. Other symptoms, itchy skin. Some women say it's crawling skin. That's a terrible feeling. Dizziness, vertigo is something that is known to be happening during this period of our life with declining estrogen. We can experience heart palpitations, like I mentioned when I talked about anxiety. Another huge one, high cholesterol and triglycerides, which we talked about. Those all happen because of declining estrogen and are very serious factors in our overall cardiovascular health. Another very interesting one is burning tongue and burning mouth. We get a change in the sense of our taste. Our taste buds change. We also get tingling limbs. I know I experienced tingling limbs along with my hot flashes, and it was just a very weird sensation. And it doesn't feel good. And it just completely disrupts your thinking, it disrupts what you're doing. And it can also be in combination with shock-like symptoms, which are like little electrical impulses underneath your skin. Many women can experience allergy flare-ups, like we talked about earlier. Another big one is urinary changes. So, urinary changes can be overactive bladder, urinary incontinence, mean because the weakened muscles in our pelvic floor can lead to that urinary incontinence, overactive bladder, having to go to the bathroom a lot, and then recurrent UTIs are also a factor, which most women aren't going to understand, and they're just going to be on, antibiotic after antibiotic for their UTIs. Not most urologists, and I say most, I'm not every, are going to say, let's check your estrogen levels, or let's think about perimenopause, or let's supplement your estrogen and see if these UTIs go away. Or let's give you some vaginal estrogen and see if that helps to heal and plump and bring life back to these tissues in that area. Women can also experience body odor, menopausal acne, and dry and itchy eye, which dry and itchy eyes are so painful. And, I know I have friends and clients that have had the itchy eye and the dry eye that, can't be resolved through eye drops. And unfortunately, they deal with it for years. And it's like sandpaper in your eye constantly. And it's not one symptom that I have had, but I think it's a terrible symptom to have to experience that can be relieved with some estrogen. And then lastly, a really big one that goes into the whole tie-in between menopause and metabolic disorders, which again, I think is another whole podcast in itself. So I can't wait. I have all these fun ideas for more solo episodes. But insulin resistance, right? Going back to our metabolic function and dysfunction. So, what happens when your cells become less sensitive to insulin? Your cells don't respond. Insulin resistance is, what when your cells become less sensitive to insulin. So when your cells don't respond to insulin, it can result in a consistently high levels of blood sugar, meaning glucose, in your blood, which can lead to things like type 2 diabetes and chronic low grade inflammation, like we just talked about. Estrogen assists in glucose metabolism in several ways. And so when we lose estrogen, it leaves us vulnerable to metabolic dysfunction and our cells' ability to use and store fuel from food, which is, the work of our cellular energy. I mean, this is talking about the science, like at the cellular level of how we function as human beings. So this is a huge one that we really need to pay attention to. So if you're someone that maybe your doctor has said that you might be insulin resistant, or maybe you are pre-diabetic, all things to think about when it comes to perimenopause and estrogen, because these are things that can down the road can lead to severe things like type 2 diabetes and fatty liver disease. And once you start to really focus on your metabolic function and your metabolic health and getting that aligned, a lot of these other symptoms that we talked about start to kind of go away, because at the cellular level, you are functioning as you're meant to function and much healthier there. So I'm listing out all of these symptoms. I'm doing this podcast because I believe it is so important for all of us to know and understand that if you are experiencing any symptoms like this, it could be due to declining estrogen in your body. And I'm not saying that's the cause. There could be a lot of other things going on, but it should be something that is at least on your radar, because it will not be on your doctor's. And that is really disheartening, but it's the great news is, as I believe there's so much hope and optimism, because we are going to get there. Basically, organically, as women, we are teaching each other. We are learning from all of the science that is out there. And we are bringing this to the forefront of medicine, and we are bringing it to the physicians. And eventually, these medical students and residents and doctors will be trained as such. But right now, our healthcare system is really a sick care system. It's a system that we go to when we are sick, and they treat each individualized symptom on its own. There are not many doctors, unless you're going to a functional medicine doctor, that are looking at your body holistically and getting to the root cause of these symptoms. So, for me personally, I had so many of all of these symptoms that we listed out over the course of the 10 years. Not all at once, and certainly some were mild and some were severe. But had I known in my late 30s, had I known at the start, at the first symptom, that it was caused by declining estrogen levels, how different would my life have been, right? I mean, I could have avoided years and years of suffering if I just knew. So that is really what I want for you. I don't regret my journey. I love my journey. It brought me to where I am today. It brought me to the advocacy and the holistic health coaching that I do. And so I don't regret any of my journey. But what I want for you is to catch it early. What I want for you is to be your own advocate, to understand the depths at which estrogen, progesterone, and testosterone, which we didn't even get to some of those today, but estrogen, this protective anti-inflammatory hormone that starts to fluctuate at different ages for every woman, right? No woman's menopausal journey will be the same. We are all very different, but that's why it's important for all of us to know and educate ourselves to understand that it could be the cause of your suffering. There is so much more that you can do once you are armed with this knowledge. There's holistic ways to heal yourself. There is lifestyle changes to heal yourself. There are pharmaceuticals to heal yourself. But once you know And once you hold the power, you can live a healthy, vibrant, empowered life because now you know. So, thank you guys so much for joining me on the podcast today. I really appreciate you listening. I really hope that you benefit and got some information out from this episode. I would love to know. Please leave us a review on Apple Podcasts or wherever you get your podcasts from. Drop a review. Let us know what you think of the podcast. Be sure to follow me on Instagram, YouTube, Facebook at Suburban Warrior. And I would love for you to tell us in the comments what you think of this podcast. Warrior up, believe in you. I'll be back next week with another amazing suburban warrior here to share her story with you. Thanks, guys. Talk to you next week.